and how to fix it, and he joins us now. Dr. McCary, thanks for being with us.
Great to be with you both.
Good morning.
Well,
Good morning.
Steve Forbes says that this is an amazing book. He says a must-read for every American. We need to be aware of what's happening in the medical system. What is broken?
Well, you know, I loved the movie The Big Short. It created literacy around the banking industry, and I wanted to create in the book The Price We Pay, literacy around healthcare. Everyone should know the basics of the business of medicine. And right now, today, price gouging and predatory billing is now threatening the great public trust in the medical profession. We've got people at home sick and scared to go to the doc. We've got hospitals violating that public trust by overcharging patients. So we can do better, and we need basic price transparency. We also need people to be educated on what to ask when they go to their doc.
Okay, what do you ask when you go to your doctor?
Well, a little known secret is your medical bills are negotiable before, during, and after care. And there's a lot you can do.
So if I'm going to go into the doctor for a strep throat, can I talk to him ahead of time?
You absolutely can, and we're trying to get doctors involved in the billing process so we can say, look, if your patient's been price gouged and even sued to have their wages garnished, as we found in doing the research, we want the docs engaged. We want community members talking to their hospital board members and saying, hey, hospitals should not be suing low-income patients and garnishing their wages. You know, if you go to buy a flight on Expedia or Kayak and there were no prices, you'd say, this is crazy. Everyone's getting price gouged by billing after the flight.
Sure.
And yet, you know, airlines could argue that we can't give you a price. We don't know if you'll consume a beverage.
My mother is very sick. She had a stroke almost 2 years ago. And we've gone through the whole process, and I have been awakened to what's really happening. It really goes back to your doctor. We went to one place, not good health care treatment. I felt like it was a business. All they wanted to do was charge and charge and charge and not really care for her. We go to another place where we meet this amazing doctor, and he makes sure his team rallies around my mother to save her life. And it goes back to just care. How do you train these hospitals and these doctors not to look at the bottom line, but to look at the patient, a life?
Well, you know, we have good people working in a bad system. Most of the hospital leaders I know, and almost every doctor I know, went into medicine for good reasons. And what's happened is we've inherited this broken system where this game of inflating prices for insurance companies and then offering big discounts to groups selectively has resulted in everyday Americans being the casualty. A lot of stakeholders are making a ton of money in healthcare, except for one, the patient. And I can't just show up and mow your lawn and then send you a bill for $4,000. There's got to be some contract. There's got to be some civility. So people need to know the basics of what to do.
There's a new John